It's really a great pleasure to be here, and I really enjoyed the talk. So at this point, and I also want to thank the organizers to give me this opportunity to present our Get Ahead platform and programs. How do I? Oh, work. So first, I need to give out this disclaimer. I'm an employee in Synonymics, and I know this is wrong, but pretty much the major part is that my talk does not constitute a recommendation of the security of our company. So a brief introduction about Synonymics. So we are an RNAi technology company and specific focus in the RNA therapeutics, oncology, fibrosis, cardiovascular disease, and metabolic disease. Our headquarters is in Gaithersburg, Maryland. This is this one? How about this one? Okay. Yeah, Gaithersburg, Maryland. And we also have an R&D center in Suzhou and also a manufacturer sites in Guangzhou, China. And we recently raised about $250 million for funding, and as well as recently completed our IPO in December last year in Hong Kong. So we have multiple different platforms in siRNA technology, and the most advanced part so far is this PMP technology. So basically, it's polypeptide nano particle, and I believe just this morning we already have introduction on this section. Pretty much, this is a histone lysine polymer, and because this positive charge amino acid that were able to interact with negative charge RNA, and that will give you this 80 to 100 nanometer particle, and for us to deliver the siRNA into the cells. This is our PMP-based pipeline. I know this is not the most important part for my talk today. I just give you an example that actually we, using this technology, we have the most advanced one. It just finished the phase 2A clinical trial. But for today's, my talk is not going to focus on this. Instead, I'm going to focus on this Get Ahead platform that we recently developed. So this, we call it Get Ahead basing basing on this Sir Get Ahead. This is who is a knight of the King Arthur's Round Table, and one of the only 3 archers of the Holy Grails. And by doing so, we hope that we can achieve the Holy Grails in the siRNA therapeutics as well. The Get Ahead platform have 2 major components. First one is called mxRNA. This is a miniature single targeted RNA triggers. And then we also have it called muRNA. Basically, this is multiple targeted RNAi triggers. Just a quick overview about the traditional siRNA mechanism of action. You basically have a double-strand RNA. And when they go into the cells, you double-strand RNA unwound, and the guide RNA is bind to the RISC, and RISC will bring it to the target mRNA and lead to the RNA degradation. And many different ways to deliver RNA into the cells, and the most popular so far it's focused on the GalNAc technology. So basically, you have a siRNA conjugated to GalNAc head, and this will bind to the receptor ASGPR, and that led to the siRNA internalization into the endosome. And just a very small amount of siRNA were able to escape from endosome. and lead to the target mRNA degradation. And as I mentioned, this is a very validated technology, and so far have several drugs being approved based on this technology. The first drug being approved in 2019. And many different leading companies in this siRNA field using this technology include Arrowhead, Alnylam, Dicerna, and Silence. And Dicerna was recently bought by Novo Nordisk. And the common feature, again, they are all have double-strand RNA and link it to the GalNAc head, just different way to link them. The our mRNA is a little bit different from what this other company doing. So instead of using double-strand RNA, we using single oligos, about 29 to 33 nano, nucleotide long, and then this were able to form kind of helping structure. And then at the end of this 3' end, we link it to GalNAc as well. So when this single-strand RNA delivered into the cells, it will open up, and the RIS were able to bring it to the target mRNA and lead to the degradation of the target mRNA. So will this work? So what we did is that we basically pull out a sequence that in Silence's therapeutics using that specific sequence, and we modify, change it to the mRNA format. And as you can see in the left-hand side, when we treat the animal with this with our mRNA, we can see a little bit this dose response inhibition of the TMPRSS6, and compared to the silencer, we achieved even better inhibition in the TMPRSS6 in the siRNA. So at the same time, we also looking into the duration of the inhibition. You can see our mRNA inhibit about 88% after 6 weeks, and this is even better than the original sequence published by silencers. So in summary, that this method give us outstanding activity as well as both in the potency as well as the duration. In addition, the advantage is that this will give us a relative easy of CMC. So I just mentioned that for traditional method, you have to synthesize one, like say, for example, in this example, Dicerna's, you have to synthesize 33 nucleotide, and then you synthesize another 20 nucleotide, then you anneal them, and to form this double-strand RNA. For us, we only need to synthesize, 31 to 33 nucleotide, and that's it. And this also gives us a solid IP position and also, freedom to operate as well. The second concept is basically the MuRNA. This is concept is using the principle described by German engineer Thames Sobrowster. So basically, it means that the spot aim to be broken. For example, in this chocolate bar or this shoulder can opening area, that this area need to be, designed to be broken. So what we did is basically we trying to design our oligo have spot to be broken. So just give you some kind of cartoon, basically, for example, this. We synthesize 2 RNA oligo and design, a spears breaking point. And after it's broken, it became 2 siRNA that could target 2 different targets. And you can also do in this one, for example, like 4 target became like 4 target in siRNA as well. I'll give you a little bit more detailed example on double targeting here. So, first strand here, and we have a little bit loop in between. And after this cut, you get RNA trigger 1 to target gene X, and then the second RNAi to target gene Y. So where this one worked, we designed 2 mRNA and to target TMPRSS6 and MAC4K4. The first mRNA, you can see that we're able to inhibit more than 90% or almost 90% of the TMPRSS6. And also for the second mRNA, it led to about 87% of inhibition of the TMPRSS6. The first mRNA lived about 79% inhibition of MAC4K4, and the second one lived about 73% inhibition. So basically, it's one single mRNA we're able to give us double targeting. This is an example we test the efficacy of this design in vivo. So what we did is that we designed the mRNA with this SBS breaking point or without SBS breaking point. And we also compared it with the siRNA, single target siRNA as well. So you can see here that our mRNA were able to deliver about similar level of the inhibition using the single targeting siRNA. And similarly, it also inhibit this MAC4K4 to the single control siRNA level. Without SBS, this effect is going to be very poor. I want to point to your attention that the difference between this and this, it's because on the left-hand side, the TMPRSS6, it's only expressed in hepatocyte. And as I mentioned, our technology, GalNAs, only target hepatocyte-specific gene. On the other hand, this MAC4K4, they express in many other cells as well. So, when we measure this inhibition, it's pretty much the kind of a lot of signal coming from other cells, not because we cannot inhibit in hepatocyte. So you can see the advantage in this multiple targeting perspective. For example, in the competitive double targeting construct, you need to synthesize 4 RNA, like 21 nucleotide, and you have to do the annealing 1, annealing 2, and then link them together. Totally have 7 major steps with need to synthesize more than 80 nucleotides. For us, we only need to synthesize 1 and 2, about 32 nucleotide, annealing, that's it. So it's simple in terms for multiple targeting. I will now focus to give you 3 programs on the mRNA technology we have been working on. The first one is STP-125G. For this one, we use a humanized liver mouse model. This is a PXB mice that it's a chimerical mouse model with stable human hepatocytes engraftment. And in the end, this is usually give about 80% of human hepatocyte, 20% of mouse hepatocyte in this model. So we treat the animal. This is treat the animal with 2 different compound, target the same target, and at different doses, 10 and 30 mpk, and then measure the effect at the end of 2 weeks. At the same time, we also treat the animal for 10 mpk and measure the effect at the end of 6 weeks. So for the first compound, the green bar here, it's the mRNA level, and the red bar represent the protein level. You can see that we see the dose response inhibition of the mRNA and also the inhibition of the protein level. This is going to give us about 92% after 2 weeks. The second compound also give us a dose response, but it's not as good as the first one in inhibiting mRNA expression. But the protein inhibition, it's also quite well. We can get about 87% inhibition in the protein level. By 6 weeks, this is like 2 weeks and 6 weeks. The first compound and the second compound, both of them, you see slightly loss of the inhibition in terms of the mRNA level. However, the protein levels still hold pretty well at the end of 6 weeks. The second program we're working on is complement factor B targeting, STP144G. So for this program, we use non-human primates to test the efficacy of our compound. And again, we choose 2 different sequences and dose the monkey at 1, 3, and 10 mpk. We also dose the monkey at 3 mpk for 3 injections weekly. So here I just give you the this 2 compound at high dose 10. This is the 10 mpk. So basically the compound 10613 that give us a mass suppression 74% at week 5 here, and we give about more than 60% reduction from week 2 to week 13. This is we are measuring the protein BB level, and our detection limit is in this area. And for the second compound, we get about maximum inhibition about 59%, and with more than 50% reduction from week 2 to week 13. And we never reached below the detection limit for this compound. Then for the compound that were treated with multiple dose 3 times for over 3 weeks, that both of them give about maximum inhibition about 68%, and about 60%, more than 50% reduction from week 4 to week 13 for the first compound. And for the second compound, more than 50% reduction from week 2 to week 13. And the mean BRQ level will reach about 6 weeks, or from this 6 weeks to 11 weeks. So, this, I think we probably still continue this experiment, trying to see how long can they last. The last program we're working on is this coagulation factor 11 targeting. I'll just give you a quick background about this blood coagulation cascade. So, there's 2 pathways for the blood coagulation cascade. One is called intrinsic pathway. The other one is extrinsic pathway. This pathway basically it's initiated from factor 12, 11, 9, and 10, and that led to the thrombin activation and blood coagulation. The extrinsic pathway basically depend on the trauma and lead to the release of tissue factor, and that will lead to the activation of factor 7, and then further activation of factor 10, and lead to the blood coagulation. There's many drugs already developed for in its pathway, including recently, dabigatran, targeting the thrombin, and also, factor 10, rebroxfen, and episbet. It was believed that if you go upstream of this targeting, then you will have less tendency to have this breathing liability, while at the same time you may be able to achieve the efficacy. So for this program, we are using only one compound and doing the NHP study again. And again, we choose like 1, 3, and 10 MPK. And also we have choose 3 MPK dose twice, or 3 MPK dose 3 times over 3 weeks. And then we measure the factor 11 activity, as well as other readouts, APTT and PT. I will explain a little bit later in the next few slides. So when we measure the factor 11A activity, you can see that this 1, 3, and 10 dose response decrease the factor 11 activity. If you dose the animal twice at 3 MPK or 3 times at 3 MPK, you see further decrease of the factor 11A activity. We also measure APT and PT. APT stands for activated partial thromboplastin test. This assay, you add kaolin and phospholipid, and this kaolin will lead to the activation of factor 12, and that will activate this kind of intrinsic pathway. If you have a lower activity in factor 11, this will leave the coagulation times longer, so you will see an increase of APTT time. For the prothrombin time test, you basically have thromboplastin that including tissue factor, and the tissue factor, again, I just mentioned that will lead to this activation from this pathway. And because in this pathway, you don't require factor 11 activity. Therefore, you will expect that decrease in the factor 11 should not lead to a change in the PT. And this is exactly what we observe. So we see a dose-dependent increase of APTT time, with the most significant increase in the APTT time that for the animal that been dosed 3 times. On the other hand, we didn't see any signal change in the PT time. We also measured the safety readout in the animal over 33 weeks. We read many different liver functional enzymes and also hematology parameter. We didn't observe any significant change of any of this readout from the baseline level. So this suggests that our technology is in general safe so far. It gives us a pretty good way to move forward as we expect. So finally, I will just give you a summary slide there where we are. So we have several programs that are already in the finished the candidate nomination, and we're going to have our first Galahad IND later this year, and follow several in next years. And I will stop here and take your question. Thank you.